so-called premium intraocular lenses are those that usually aren't available on the NHS, and as the name suggests, they do cost a bit more to have put in your eye. And it's all about whether or not you're going to need to wear glasses afterwards, or indeed whether you want to be less dependent on glasses. So in the NHS, and indeed for most of my patients, they will have a standard monofocal lens, which should give you good distance vision, but you will still need reading glasses. If you have astigmatism, which is where your eye is more rugby ball shaped than football shaped, then you may require a toric lens, which corrects the astigmatism, so will give you sharper distance vision, but you still need reading glasses. And then there are multifocal lenses, which should give you both near, intermediate and distance vision without glasses. And of course, if you have astigmatism, you would then need the toric version of that multifocal lens to make it properly sharp. There are also extended depth of vision lenses, which I suppose give you some near and intermediate vision, but not as much as a multifocal lens. So that's the sort of range of premium lenses that I offer. That's a good question, and to be honest, there is no ideal candidate, and you don't really know if they're right for you until you've been to see one of us and had the appropriate measurements done to see if your eyes are suitable for multifocal or toric lenses, and then after we've done these measurements, we would then have that discussion, explain the pros and cons of premium lenses. And to be honest, I err on the side of caution. I'm certainly not going to try and sell you a lens that you either don't need or want. So it's really about each patient making an informed decision on what lens is best for them. And I think it's important to realise that premium lenses, just because they're more expensive, it doesn't mean it's better or right for you as a patient. And that's why I would hope to guide you to make the correct decision. I think if you are a suitable candidate and you are keen to be less dependent on glasses and you can afford it, then yes, they're definitely worth the extra cost, and many patients are absolutely delighted with them. But you need to be motivated to make them work, and they need to be right for you. So of course, first of all, there are the general risks of eye surgery. There's always a very small chance of a disastrous complication, such as a bleed or an infection in the eye, which may take your vision for good. But then on top of that, with premium lenses, there is always a small risk you will still need glasses. The biological nature of the eye means that the measurements aren't always exactly right. So you may still need glasses for some more exacting tasks, such as spreadsheets on a desktop computer or threading a needle, or looking at text in low light. So lighting is often quite important. And then often people describe halos or rings around lights, such as headlights at night. And this is because the lens themselves are multiple concentric rings. And majority of my patients just get used to that, and it doesn't seem to bother them because they have such good vision as well. And occasionally people do suffer from glare in sort of bright lit halogen light type environments as well. But majority of patients are absolutely delighted with the result of premium lens surgery. So these lenses stay in your eye forever. It's very rare for them to have to be removed. So it's a one-off procedure. There is a small risk of the little bag that the lens is inside your eye can develop a film over it, and so vision goes a bit cloudy again, and then we have to manage that with a small laser procedure in clinic, and that should give you back the vision that you had after the surgery. And again, that's just a one-off procedure as well.